Fantastic. Hello, hello, and welcome everyone to the virtual space. You are in the right place at the right time. Every day counts community conversations on school attendance. We're so excited to see so many people in the room today, and we know that there are lots more joining us. If you could just let us know in the chat your name, where you're representing, like what state. I'm zooming in from Atlanta, Georgia, and what organization that you're joining us with, or if you have lived experience, or a little bit of both. We love to see it in the chat. We like to say hello to people as they come into the room. We are going to get started on time because we have a lot of ground to cover and just an hour to do it in. So continue to say hello in the chat and we'll acknowledge you there as well. As a quick disclaimer, we do like to let folks know that the session will be recorded and we will post the recording on our website. So if you like to listen into reruns and hear this panel all over again, we encourage you to go to our website where you can hear it. And also we like to share that we are absolutely grateful for funding from SAMHSA, but we like to let folks know that all of the panelists here are representing their own views and not necessarily the views of SAMHSA or the federal government. Also, if there are any issues with Zoom, but knock on wood, there will be no issues. But if there are, we'll end this session and we will get back in touch with you on how you can rejoin. But again, fingers crossed, toes crossed, none of those issues will happen here today. We like to give a really big shout out to all of our partners that allow us and support us to make this all happen. We provide to you all podcasts, individual consultation, coaching, training academies, all of these things at no cost to you all. And so we hope that you continue to share these sessions and share all the offerings that NTAC provides. I guess I should say our title, NTAC. You might be wondering who we are, but we are the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health. We are excited to offer this session in collaboration with Burke, and we are going to hear from the Burke co-founder and director in just a moment. I want to go over a couple of more things really quickly, though. You can receive a certificate of completion for this event. If you like one of those certificates, please email Bridget. Her email's here on the slide. We will also share the presentation slide deck and the recording with you all after the session is over. We want to give also some acknowledgement to our team for producing our first ever digital digest. Bridget is going to put a link in the chat right now where you can go and check it out. This digital digest is providing resources, insight articles, interviews from teachers and principals from across the country, all talking about uplifting children's mental health through school-based programs and services. So we hope that you'll take a moment to also look through our digital digest and give us some feedback. Let us know what you think about it. All righty, so moving right along, I am so excited to introduce to you all today's panel moderator, Dr. Sonia Douglas. Dr. Douglas is a professor of education leadership at Teachers College, Columbia University, also the director of the Black Education Research Center. She will be guiding our panel through questions and taking questions from you all in the chat as well. So she is our moderator, and our awesome group of panelists joining us, Dr. Dawn Brooks DaCosta, Deputy Superintendent from Harlem Community School District 5, Dr. Derek Smith, Associate Professor of Educational Leadership at University of San Francisco, and Dr. Elliot Atisha, a Senior Fellow for Health at Attendance Works. So we have a great lineup for today, and I am super excited about what they have to share. Earlier, I said leave your questions in the chat. I need to take a couple steps back. If you have questions for the moderator or the panelists, please leave your questions in the Q&A, using the Q&A feature. With almost 200 people here, it's hard to keep track of all the questions that are in the chat. So if you look in your toolbar at the bottom of your screen, there is a more button. When you click on that more button where there are three little dots, there will be a Q&A function that pops up on a little short list. Click that Q&A function or that button, and that's where you can leave your questions for the panel and the moderator. So with that being said, I am going to share a quick video that gives us a little context about what we're talking about and why we're here today. And then we'll hop right into a conversation with our panelists.
Crisis point. In 2021, there were 2 million dropouts.
We're losing way too many children. They're either not showing up or they're leaving early and really not having any opportunities beyond that.
Nationwide, for millions of students, a typical school day is filled with too many obstacles. From issues with transportation, caring for loved ones, to depression and anxiety, students are missing school.
The education system is not working for Black and African American students. It's not working for students who may speak a language other than English. It's not working for students with disabilities. It's not working for students who live in poverty. And it's not working for students who don't have an advocate who can make sure that their needs are being met.
Every day, these Compass Peace Builders, as they're called, go out into Hartford.
I have a couple home visits.
Meeting young people where they are.
A youth in the hospital and then a mom.
Offering job training, providing basic needs like food, clothing, shelter, and friendship.
So the question of the day today is, what is an obstacle that keeps youth from going to school or causes them to drop out of school?
I think one of the biggest issues is trauma. We live in a traumatized environment and our schools are not trauma informed.
Compass has been working with 17-year-old Raheen Hodges for a year.
Are you in school?
No, not right now.
You dropped out.
Yes.
Why?
To be honest, when I came back from COVID, it's just like felt like school wasn't like motivating me.
Were you absent a lot?
No.
No, you would go.
I would show up, but I just wouldn't like participate.
What kind of grades did you get when you were in school?
Like C's, D's, and like when I did try, I would get like B's and A's. I feel like they gave up on me because like when I would try, I just wouldn't get the help that I like needed.
Give me an example.
Like they would make me feel like I was stupid. Like I would ask for help, and like they would make me feel like I was just like dumb or something.
Okay, well, welcome everyone. My name is Sonia Douglas, and I'm really delighted to be here for the first of 4 sessions, listening sessions focused on chronic absenteeism. And I first want to take a moment of personal privilege to thank Ashley Singleton and Lisa Knight for just their commitment and dedication. It takes a lot of coordination to host a series like this. And so just their concern about this issue and their willingness to reach out and to figure out how we can begin to identify solutions to really provide the supports and the conditions that can help support our students in wanting to attend school and to be present and to be able to access the education that's so important to them is really, I think, important to why we're all here today. So I wanted to thank Lisa and Ashley again and Bridget for their support in bringing us all together. And I want to thank and introduce our panelists. They've been introduced, but I'm going to give them each time to talk a little bit more about their own positionality, who they are, and what they bring to this issue. But before I do that, I do want to give some framing to this issue of chronic absenteeism. I encourage you to watch the ABC Nightline special because I think it does include student voice and perspectives that are really important to this issue and may not be front and center when we talk about the research that focuses on chronic absenteeism as a problem without necessarily looking at the context and conditions and the real life experiences that people are facing that make it an issue. And so I'll start by saying that the problem of chronic absenteeism, which is defined as a student missing 10% or more school days during the school year, continues to present a major challenge for schools and society in the US. According to the US Department of Education, more than 8 million students, or roughly 15% of students across the country, have been deemed chronically absent. And this transcends all grade levels and reflects a phenomenon that has worsened since the COVID pandemic, which was referenced in the video. It has nearly doubled in the last 3 years. And so in addition to the consequences of missing school and what it means for students in terms of test scores, graduation rates, and its impact on future life chances, within the context of education, we were really thinking about how more cross-sector collaborations and conversation can help us to identify and address the issues of chronic absenteeism, which brings us to the panel, the really amazing panel that we've been able to assemble here today. And so I'm going to invite them to each maybe open up with a minute or two about who you are and what brings you to the problem of chronic absenteeism. And I'll invite Dr. Dawn Brooks DaCosta to start. She is the Deputy Superintendent of the Harlem Community School District 5 in New York City. And so I'll just invite you again to tell us who you are and how your work is connected to this issue of student absenteeism in schools.
So good afternoon. My name is Dawn Brooks DaCosta, and I am the Deputy Superintendent of Harlem Community School District 5. And so I bring greetings from Harlem, from the Mecca of arts, education, and culture in New York City. And so we struggle as a district with absenteeism and chronic absenteeism that has been increased since the pandemic, but was already an issue pre-pandemic. And so it's been an issue that impacts so many different things, including academics, school culture, et cetera, and our deep concern for students. And so it's become a focus for us, and we're appreciative that our new chancellor, David Banks, has really charged all of the districts to focus more on this issue and has given us staff to be able to do this, which is historically what has not happened across the districts, that now we have a staff that is supporting us with that. And so we have a great deal of efforts and are continuing to try to grow in this area. Thank you so much for having me.
Thank you, Dawn. We also have Dr. Elliot Atisha, who is a pediatrician, but also a senior health fellow with attendance work, and has a perspective around the health conditions, right, that can contribute to why students aren't attending school. And so Dr. Atisha, if you could tell us a little bit about your role and work at Attendance Works.
Thank you so much, Dr. Douglas. I'm super excited to be here. I am a pediatrician by training, and I've spent about the last 14 years of my career focused on school health. Chronic absenteeism, specifically the connection between health and attendance, has been a big focus of my work, starting in my initial years of school health, where I was given the opportunity to oversee a mobile clinic program that brought health services to select Detroit schools. And then I went on to serve as the health officer for Detroit Public Schools Community District, where our Office of School Health and Wellness was really focused on ensuring that students received the health supports they needed to show up to school healthy and ready to learn. And then after stepping down from that role about 2 years ago, I joined Attendance Works, where I currently serve as their senior fellow for health. But as a healthcare provider who initially started in school health, bringing services to schools, and then spent many years working inside the district, working with partners to expand the work around health services and ensure that they received the care that they needed. I saw the challenges, I saw the barriers, but I also saw the opportunities and realized that no one can do this work alone. It takes collaboration and partnerships and raising awareness, which this session will only add to what's already happening in the work around chronic absenteeism. So thanks for having me.
Thank you for being here. We also have Dr. Derek Smith, who's joining us. He's an associate professor at University of San Francisco in the School of Education, and his research and scholarship focuses on issues of school discipline and culture, social justice leadership, and equity in higher education. And so we're excited to have his perspective, which provides an evidence base and research as to why many students are not in school. Dr. Smith, if you could tell us a little bit more about your work.
Yeah, and thank you for having me. It's good to see everyone on here. I'm coming from Oakland, California originally, and I spent time as a high school instructor as well as a school principal in the city of San Francisco. Currently chair of the Department of Leadership Studies in the School of Education at the University of San Francisco. And I oversee the administrative credentialing program for our Bay Area school principals. I just think that it's a critical issue to think of or consider from all different aspects and all different contexts. Of course, I think that there's not enough emphasis on the role that school climate and school culture plays in drawing students into school, but also keeping them safe while they're there, keeping them engaged while they're there. But I think that dynamic depends on the context in your region, your location, the culture where your school and your school district is. And you're going to face a myriad of different issues that could all be kind of assembled in one particular situation of a given student and their family. So while it's a very complex situation to deal with, I believe that schools can actually do a lot to help students be resilient in the face of the issues that they're facing off campus, while also creating a space where they can grow and develop better techniques for school and learning engagement while they're on campus. And I just think there's a lot of power we have that we're often under-resourced and sometimes distracted from using.
Thank you for that. So we're going to have kind of a semi-structured conversation. We do have a set of questions, but I'm going to invite the panelists to jump in, in the order that you see fit. I think before we really get started, I'd like to kind of get a sense of how you're defining chronic absenteeism, or if there's a different term or language or conceptualization of this issue that you'd like to introduce. I think one of the challenges could be the fact that when we talk about chronic absenteeism and a lot of the research and scholarship, it is focused on kind of a deficit perspective on students and families and why they're not participating in school. And so just wanted to open that up and give you an opportunity to kind of talk about how you frame this issue and approach it as part of the ways that we think about solutions. I also wanted to quickly note that I know that there were several participants who indicated that they're not able to post questions or comments in the there's no Q&A on the menu. So just wanted to kind of acknowledge that, and we'll figure out a way to make sure that we're able to hear from you. So with that said, who would like to start with their definition of chronic absenteeism?
I can just share
Hands
from
up.
the
Oh, go ahead.
district. Oh, sorry. So just from the New York City Public Schools definition that we use in the district, it's 20% absent days, which equates like about 36 days or more absent within the school year.
Thank you. Dr. Atisha?
Yeah, thank you. So I was just going to jump in and share the so the definition that we use and now has been adopted, at least to have that initial cutoff of where you're chronically absent, which has now been adopted by most states in the country, is 10% or more of the school days. 2 days or more a month. And sometimes when you look at, okay, is 2 days a month really that big of a deal? But once you start adding it up, and if you do that consistently across the first 9 months of the year, you are now chronically absent. It's really, and then if you did that for 10 years straight, just think about it. If you were chronically absent at the lowest level at the 18 days, and you did that for 10 years straight, you just missed a whole year of school, a whole year. And if you're up at the level of 36 days a year, and now you've missed 2 days a year, right? 2 years in that 10-year period. And so, we really need to make sure that we are intervening as early as possible, especially for those high-risk students, so that we can make a big impact on getting the supports and services to keep our kids in school. And we really need to make sure that we're addressing the underlying causes, which I know we're going to get into a little bit deeper later in the discussion. But as we define chronic absenteeism, what we've done at Attendance Works is we've really taken a 4-bucket approach. Is it related to barriers? Is it related to aversion? Is it related to disengagement, or is it because of misconceptions? And so understanding what the factors are really allows you to respond and provide the right interventions to keep our kids in school.
Thank you. Dr. Smith?
I don't have anything to add in terms of the definition. I think what we just saw is, the advances in locations that are focused on the issue versus how districts actually see it in terms of how they can allocate resources to track down students, when it's even noticeable. And, how does it translate to state determined seat time? All those different things can lead to these small disparities, and well, not small, but significant disparities in how we view student absenteeism. I think sometimes in schooling, we can discuss students who are absent and kind of lump them in the same category, right? And so they're truant, or they're missing, or they're skipping school. And I think as the research states, it's important to try and delineate the reasons why certain students might be missing, just in terms of categorically, right? Some students are not coming because of what's happening in the home, or maybe a lack of nutrition, or a lack of energy, or illness. Some students have certain work responsibilities, but I also think it's important to note that there are students that some literature calls school phobic, right? Historically, right? That there's something happening in the school building that is making it either a scary environment for them, or an environment in which it's inhospitable. So I think within those ranges of what we're considering absenteeism, of course, the next part of discussion that we'll talk about is, what are those categories, and what does it mean when students are doing that?
Well, maybe you can start help us to kind of better understand what are some of the causes that you've identified in your experience and in your work.
Sure. Well, we're looking, yeah, sure. Well, statistically, we're looking at schools having more student victimization. So students between the age of 12 and 18 experience more victimization at school or during school than they do away from school. It's about 30 per 100,000, 30 victimizations per 100,000 students in the country experience that on school campuses, versus 20 victimizations per 100,000 students off campus. And it's been that way for 30 years outside of 1997. It's been that way for a long time. And a lot of those situations involve things like bullying, harassment, racism, things of that sort. And in these situations, gang involvement, gang pressure, these type of situations can help students stay away from school, just as kind of an intuitive sense of safety. And in the situation like this, schools are often underprepared to intervene upon these issues when students are facing them. Even when you look at some of our solutions, or even how schools contextualize intervention in the modern era, we talk about intervention usually as programs, programmatic interventions, which if you go back years far enough, 40, 30 years ago, an intervention was to intervene in the act. But we discuss intervention now as a program to send a student to, or some type of process that ends in some resolution. And so what you end up having statistically is students that are experiencing things that they feel are harmful to them, or scary to them, and not necessarily feeling that they can confide in adults to have a safe and even discreetly handled resolution, right? And this often happens, particularly in communities that also have high issues of absenteeism. Right. So if you look at particular aspects of the literature, it talks about how students, and there's a particular study out of Johns Hopkins, it was a team at Johns Hopkins and Arizona State University, looking at this kind of multi-layered analysis of chronic absenteeism in school culture. And what they found was that students that rated their school climate as less than optimal, or not necessarily, a healthy place, also happen to be schools that had higher poverty rates, higher students of color, and chronic absenteeism. Now, there's a chicken and egg question of whether the chronic absenteeism caused a poor culture, or the culture caused a chronic absenteeism, but there is some link established in the literature between how students experience a sense of belonging, a sense of voice, a sense of safety, whether resolutions and threats are handled appropriately and quickly. All those types of things can lead into whether or not students attend school. The last thing I'll just throw out there really quickly is that, looking at the nationally reported data, we're looking at just about 4% of students reporting that they are avoiding school because of fear. But when you look at a US student population of about 50 million in public schools, 5% becomes a very significant number of students. And so while I don't think it's the primary cause for chronic absenteeism, I think it's one that's overlooked.
Thank you for that really important context because, again, you're highlighting all the myriad factors and context and other considerations that may be reasons for why students aren't attending school. Dr. Brooks DaCosta, maybe you can tell us a little bit more about, just in your experience, what are the leading factors for students in Harlem in particular, the reasons that they don't attend school? And then if you could also give us maybe some sense of a demographic profile of students. You know, Dr. Smith kind of mentioned issues of poverty. I would imagine race as well, and then issues of bullying and other factors that show up in terms of school culture and climate. So just want to hear a little bit more about what that looks like on the ground at the district level.
Yeah, so I do appreciate that Dr. Smith shares that the context is different, depending on where you are. And so for us in Harlem Community School District 5, we have 23 schools, K to 12, and a higher poverty rate, more than 80% poverty rate. We have a high students in temporary housing rate as well. And so we find that that is actually our population that has the highest level of and makes up the majority of our chronic absenteeism students. So we're doing a lot of work around school culture and social emotional learning for adults, as well as students and families, to make schools places where students want to be, because we know that this is also a factor, right? That students have a trusted adult that they connect with at school, that they look forward to something that happens during the day, whatever that is, whether it's during the day, whether it's after school programs, enrichments, etc. They want to feel cared for. And this work really has to start with the adults. And so that's what we've prioritized in the district. Also, mindful practice and other things that can help students mitigate stress and trauma, and see the school as a safe place. And with all of that, we still have issues of chronic absenteeism. Like I said, primarily students in temporary housing that are transient or also have issues at home. Sometimes we'll have a student that comes to the school students in temporary housing, and then we can't find the student for a while because they've moved to another location. And then that sort of affects that school's attendance because until they find that student, the student is marked absent. And so there's also some policy barriers for the school, and they do outreach, and we've used a lot of the attendance work resources, specifically the success mentors, attaching a person to a family. I also appreciate that each family is different and each family situation is different. And so having someone that is constantly in contact, checking in, finding out what's going on, again, another personal connection. We also find that our very early childhood students make up a lot of the absenteeism rates as well. And so we have 3K, we have 4K, we have kindergarten, and specifically during the pandemic, we've kind of reverted to a default of staying home, right? And so there was this whole movement around people being afraid of sending their child to school for health reasons, not just for the child's health. We have high asthma rates, et cetera, but also because there was family in the home that were like at high risk and didn't want children to come home and bring home something that really may impact the family. We saw definitely disproportionate death in our community with COVID. And so people, I think, are holding on also to some of those fears that we had. And so younger students, when, it appears that someone is not feeling well, they're also very apt to keep the youngest ones at home as well. But once they're in school, they are part of the school. And so when you're sending your 3-year-old to 3K, sometimes people see it as a daycare. And so I can send them sometimes, and sometimes I don't need to send them. Not understanding, like Dr. Atisha said, that even the lowest amount of regular absences really does add up and creates a wider gap from what students are able to adapt academically in the classroom and just missing hours, just missing minutes become missing hours and missing days. And so we've really had to communicate with families about the impact of a day of missed learning on their overall learning and how this affects their trajectory moving onward, especially with our mission in the city of New York City Reads and trying to really teach kids the foundational literacy. The more you're absent and miss those basic foundational skills, it just continues to add up as you go on in years. So those are some of the factors that we've seen in District 5.
Right. And in addition to those factors, I mean, there's health factors and considerations, right, that also may prohibit students from attending school. Dr. Atisha, can you talk about some of the things that you've seen in your practice and in your work with attendance works around health and why students aren't attending school?
Absolutely. Dr. Brooks DaCosta and Dr. Smith mentioned some of these, but I'll go over some of the more common ones briefly. And it could include things from common illnesses and injuries to chronic health issues such as asthma or behavioral health issues. It could be dental issues. But if you look at just asthma alone, 14 million days a year annually are missed from asthma alone. And that doesn't account for all those days that a child was up coughing all night from their asthma, but still somehow makes it to school, but now is falling asleep in class or is having a hard time staying focused or is acting out in class. And we also know that asthma impacts academic achievement. Children with asthma also perform worse on tests of concentration. And those kids who are struggling cognitively, they're less likely to feel connected and they're less likely to attend school. And of course, asthma is just one of the many chronic health issues that our kids are dealing with. And then you have behavioral health issues, which can also significantly impact attendance. Roughly 20% of kids are dealing with behavioral health problems during their school years. But sadly, especially when it comes to poor socioeconomic areas, about 80% of those kids, because of the stigma and because of the barriers around access, they're not getting the treatment that they need. And students with behavioral health issues miss over twice as many school days as those kids without. And then, as was mentioned earlier, if the school is perceived as emotionally or physically unsafe, then they're just going to avoid school altogether. Bullying is just one example. We're also seeing, especially post-COVID, a lot of issues around anxiety and kids not wanting to show up to school. And then sometimes, anxiety may also mask itself. A child doesn't want to go to school, but doesn't really want to tell the parent why or explain the reason behind it. So they wake up and they say, I have a headache or I have a stomach ache. But really there's some underlying anxiety issue that needs to be identified and addressed. And then dental caries is another one. Significant number of missed school days. It is the most common chronic disease of childhood, but it's also preventable, right? And but sadly, it contributes to about 2 million days a year of missed school. And those kids with dental health issues are 3 times as likely to miss school as kids without. And so each of these health problems can really influence a child's motivation, their ability to learn. It can affect their academic achievement, their connectedness to school, and the whether or not they're going to be able to show up. But then we can't also forget the social determinants of health. Is it an issue of transportation? Is it a healthcare access issue? Is it a food and housing insecurity? Overcoming these challenges, our schools cannot be expected to do this alone. It really takes collaboration and partnerships to make sure our students and our families get the support that they need.
Thank you for that. I mean, I think there's just so many complexities, right, to this issue. And I'm wondering, given the interest of time, how we can begin to think about the partnerships that are needed, the collaboration that's needed to identify and implement solutions around this. And so I'll start with Dr. Smith. What are the agencies, services, or stakeholders, policy actors that might be a part of the solution when it comes to school attendance? We've named, again, so many different issues and variables. What do you see as the key individuals or organizations that need to be a part of a solution? As I'm looking through the chat, I see that we have this, wonderful collection of people who work directly with parents, families, with agencies that are providing these supports. How should we work together to be able to tackle this issue in an effective way?
Yeah, well, I think my colleagues are hitting it, right on the head there. I think that it's so one, it being such a contextual issue and things being so complex from one family to the next and one situation to the next. I think being able to identify local nonprofit organizations and local city and county resources are critical to a school being able to address their issue. Some things, depending on your city or a rural area, you might need something that's very neighborhood focused, while other locations can do something that's citywide. But I think it starts with identifying the actual issues that your students and families are going through. If it is a housing issue, then you have to work with both government agencies and non-government organizations to see if you can actually provide direct pipelines to housing for your families that they didn't possibly even know about, right? Similar things with nutrition issues, similar things with health issues. If you're in a city environment and some suburban environments, some of these things are more accessible than they are in rural environments. And that's the tough part, that when you need a community response to a community issue, but there's not community resources there, you really do have to rely on the state, and you really do have to rely on partnerships between schools and between districts to galvanize resources such as grant work and bringing in agencies to work with a collective group of schools and institutions. So my recommendation is always to start with the places that are specialized in addressing those issues. Don't necessarily put it on teachers and counselors to now suddenly become housing specialists and nutrition specialists. Really reach out to local agencies and those responsible for providing your city or county with those resources, and begin that discussion of how you can be a source for referral or build more sustainable partnerships through grant work or any other type of MOUs.
Thank you. Dr. Brooks DaCosta, any thoughts about that? Again, working in a school district, you mentioned kind of the chancellor's vision and push to provide those supports. Where does it start though? Is it the district? Is it the nonprofit organizations? Is it the government? What is your recommendation, or what have you seen work in your experience?
So we have many of our schools now that have to develop their own attendance teams. And so this is maybe something that has not happened in the past, supported by our attendance director, Dr. Ferreira at the district office, where she goes and sits with those teams. And the teams are wide ranging, right? So it's people from different aspects of the school. Sometimes you'll have your school aides, your secretaries, your paraprofessionals, your parent coordinators that relationships with families. So it's not always just about an educator or a counselor, who is good to have on the team. Many of our staff that are support staff actually live in the neighborhood where the school exists. And so they have personal connections with the families. So you want to have those people on the team. Again, and serve as those success mentors. We also have a community school model in some of the schools where they have a CBO, a community-based organization that is a part of the school. And that staff is considered part of the staff. And so, like Dr. Smith was saying, these are groups and nonprofit organizations that have the resources and the knowledge to be able to help families in a wider way. Housing, jobs, education, health services. Some of our schools have a school-based health clinic, right? And so when you're able to provide all of these resources on the school level, it really does empower the school and build the capacity of the school to be able to provide these resources. And so we're lucky to be in its urban area to be able to have access to all of this, but seeing our community as part of the school and not something separate from the school is important. And utilizing the wealth and knowledge of the community and those nonprofits is important, because to the point of my colleagues, the teachers cannot do everything alone with all the other things that they have to do during the day. Also using attendance works and using resources that are research-based and work. Those are our guides for the schools. So they don't need to reinvent and try to create policy, right? So there is research that they can pull from and utilize those resources to use on a daily basis. And this is an ongoing, everyday, all day thing that happens, and it changes from one day to the next. And so those attendance teams have to be really strong and consistent. We have a few that are going to homes, picking up students, like the walking school bus. And so every family has a different situation, but I think the school developing a support system for themselves is really important, because there is not one person that can do this alone.
Right, and I think a great example, and just our opportunity to meet each other in preparation for this discussion was the fact that your district has been benefiting from the resources provided at Attendance Works. And I wanted to hear more from Dr. Tisha about some of those partnerships, and again, who you think needs to be at the table if we're really seeking to tackle this issue of absenteeism, particularly from a health interventions perspective.
Yeah, so thank you for that. And Dr. Brooks DaCosta, thanks for mentioning the resources at Attendance Works. We've developed some really neat resources for parents and educators on ways to stay healthy, on reasons to go to school or stay home, on anxiety. So I encourage folks to take a look at some of those resources, and we'd be happy to share them afterwards. But and we worked closely with the National Association of School Nurses and with Kaiser Permanente to develop many of those resources. We brought school health experts from across the country to review them, and they're based on best practices and evidence-based interventions that you can use to help our kids stay healthy and stay in school. But I think Dr. Smith and Dr. Brooks DaCosta both mentioned this. Our kids spend half of their awake hours at school. So there really isn't a better place, especially in poor socioeconomic areas where you have all these challenges and barriers, to bring those services directly to schools. But even before that, we need to make sure that the foundations are in place for this work. We need to make sure that policies are in place to help improve climate and student connectedness. We need to really take a whole school, whole community, whole child approach to promoting student health and improving academic performance. And there needs to be a focus on infection prevention and screening for specific health issues like vision and dental and behavioral health, looking at food and housing insecurity. And this requires working closely with local and state health departments to make sure that we can bring these services into our schools. School nurses, they are the health experts in the school health setting. They have the expertise in identifying patterns of symptoms and student needs, and getting kids connected to necessary health supports. They're really the navigator when it comes to getting our student health needs met. And if you look at studies, 95% of kids who go see a school nurse are able to get back to class. When you don't have a school nurse, that number drops to 83% because they end up seeing a front office person who doesn't have a background in health, and then the parent gets called, might have to leave work to come pick up the child, but then that child's health issue may also not get addressed, right? And then, which may lead to additional missed school days. And then you have school-based health centers, as Dr. Brooks DaCosta mentioned, having a whole center in a school, health center in a school where you can get full comprehensive health services, where you can get vaccines, where you can get chronic diseases managed, where you can get your well care visits. And then, knowing the challenges that students are facing around behavioral health, we talked about this a little bit earlier. We really need to make sure that our schools are taking that trauma-informed approach that Dr. Smith mentioned, which can also help the adults in the school to recognize and respond to students who have been impacted by trauma. And then that helps our kids show up to school and also plays a big role in decreasing suspensions. But then as we look at all this data, and I'm gonna tie this up, we need to make sure that as we're collecting this health information on our students, we need to know what our health issues are, who has asthma in school, who has seizures, who has diabetes, who has behavioral health issues. And then we need to be able to get that information to need to know individuals so that care can be better coordinated, more comprehensive. And again, it takes a team-based approach to do this.
Yeah, so you have me thinking about, again, all of the strategies and the things, the processes that we know work, it sounds like. And it sounds like to some extent we might be preaching to the choir in that all of us are very much concerned about supporting students and making sure that they have what they need to be in school and to be able to access all of the wonderful resources that might be available. Again, we're saying that in a lot of places they aren't there, the resources aren't there. So I'm wondering what needs to happen. What would you say, why haven't we been successful in addressing this issue to date? And are there any big ideas or things that you think needs to happen now, given what we already know about this issue and given your own experiences that explain why we haven't got there and what we would need to do going forward to be able to really address this issue effectively? Dr. Smith?
Oh, I get the crack at the big question, huh?
Yes, big idea.
Well, if I had the answer to that, I'd probably be pretty wealthy right now. But I will say that the answers are out there, and folks are already implementing answers, and they are working for various families in various locations. I think when I look at larger school districts, well, even smaller school districts, I think the difficulty is that schools have long departed from being deeply connected to the lives of families. I don't mean educators. I don't mean the educators. I mean the way schools function. I believe we've moved away from even perceiving ourselves as an extension of the family. And I think it makes it difficult to get back. You know, when you go through No Child Left Behind and you go through, you know, hyper testing, you go through struggle to retain teachers, you go to stagnant teaching salaries, you go, I mean, it's a lot. So I feel like the answers are, you know, some of the things that, well, all of the things that we covered here and more, right? And I think that if folks continue to work at these strategies, they might see some progress. But I think we're looking at a larger social issue of whether or not families and children are in environments that are conducive to them showing up to school and being able to learn without these factors being so disruptive to people's health and mental health and their connection to the learning process. I think schools are always going to be fighting uphill to maintain kind of the sanctity of learning and learning spaces. So, you know, I think there's a number of reasons why it hasn't happened. I think it's based on maybe our social stratification system and what students are valued and what students aren't, who's expected to achieve and who isn't, what calculations go into our larger system based on who doesn't historically achieve. And then what we pay attention to when it comes to resources. I mean, even regarding student health, we have a lot of money going into making sure educators are trained against school shootings right now. And that's great. But non-fatal victimizations are at about just under 800,000 reported non-fatal victimizations a year. And we might have, you know, 6 people die, 12 people die, and it's a lot of heavy fatal loss that we have. But fatal losses are not the only type of damage that we have happening in schools. So I just think that there's so much going on, and I think educators around the country are trying, and I think we need to just keep going at it.
Dr. Atisha, why haven't, I mean, given the work that you've been doing in attendance works, what do you see as the biggest challenges and barriers to increasing the number of students in school?
Yeah, so I think one area that we have some work to do in, and there's been amazing work that has happened around chronic absenteeism, and you know, and when it comes to health, I think sadly it took COVID to make us realize how important it is to address the health-related issues that our children and families are facing. But I think we have great data on excused versus unexcused absences, right? But the data is really limited on the reasons why kids are missing school. Is it a health-related issue? Is it a transportation issue? Is it a food and housing security issue? And Dr. Brooks DaCosta mentioned community schools. You know, when you look at community schools have really proven to help kids stay in school because they're helping families get the resources and the supports that they need. And bringing those supports and services to the schools, raising awareness, removing the stigma from seeking out such supports and services, that takes that plays a huge role. And then, I mentioned briefly earlier the whole school, whole community, whole child model. I talked a little bit about health services, but if you look at that model, health services is just one of 10 components, right? You need to think about the physical environment, the health education, teacher wellness. Like, our teachers are taking on so much from the things that our kids are bringing into the classroom. We need to make sure that our teachers have the supports and resources they need so that they can show up to school to actually teach, right? And not have to deal with all these other issues that they're having to deal with, which only hinders the learning environment. So by having those supports in place, and we really need to think about things in a tier-based approach. It starts with prevention. If we don't have that foundation in place, then it ends up being really difficult to do the work that needs to be done at tier 2 and tier 3 levels. And again, schools cannot do this work alone. It takes collaboration between multiple sectors, health institutions, education systems, local and state departments, boards of education, community leaders, and of course our families. Parents have a huge role to play here. And then our students, their voice matters so much, right? We're talking about our students. They need to be at the table in this conversation. There's a lot of great work happening around peer-to-peer intervention. And I think the more we can expand that work, the bigger an impact we're gonna make. But there's lots to be done, but there's also lots of great work happening. And I think I'm energized just by seeing all the attention that chronic absenteeism is getting. And there's a group of pediatricians who are working to make attendance a vital sign. So when you go in to see your pediatrician, they should be asking about attendance the same way they're checking your blood pressure and your heart rate, right? Because we know what happens if you don't show up to school. So we need to be taking a deeper dive into the issues around attendance, identifying as early as possible so that we can get our kids healthy into school.
Yeah, I love that. Just even the example you give about just asking the right questions across sectors, right? As we're engaging with students and families, are there ways that educators can ask questions related to health and vice versa to help get a fuller picture of what students and families are experiencing? Dr. Brooks DaCosta, can you talk a little bit more about what you see as maybe, I mean, you're doing some of this work already, but like any big ideas that you have around how we can really put a dent in this issue?
Yeah, so some of the things that we've been doing in the district again is supporting the adults. Like Dr. Atisha was talking about, is these are the adults that we have in front of the children, and these are the adults that we have connecting with families. And so when I say adults, I'm talking about all educators, school leaders, teachers, support staff, and families that are caring for the children. And the families are a part of the school, and they need to be seen as a part of the school community. Some of the work that I talked about with supporting families individually and targeting support to their individual needs, utilizing community-based organizations, developing teams that can handle this work and be supported through this work that happens and changes on a daily basis. But also really around what we were talking about with the student wellness, the trauma, the anxiety, not just of the students, but also of teachers and parents and supporting them. So in our district, we're using a CRASL model, culturally responsive social emotional learning. And we are engaging several community-based organizations to make sure that the schools are places where students see themselves in the learning. They see images in the learning of people that look like them. They see models of excellence when they come to school. They feel encouraged by that, but they're also cared for. And they're also taught strategies on how to regulate when things are getting difficult, when we're trying to manage stress, which we all are. And this practice is also good for the adults, right? And so one of the factors that I saw in attendance, looking at attendance works, research, is that the absence of a teacher is also highly impactful on the student. When I have a long-term sub, when I feel I'm in a place where I'm not going to be as safe as I usually am, like to Dr. Smith's point, this is going to affect my attendance. So we are directly connected. The adults, the care for the adults and the care for the students is directly connected. And we need to see that holistically and support people holistically, not just academically, but socially, emotionally, and also culturally.
Thank you. I see we have 4 minutes left. I do see a hand up, and I know that there are some slides that we wanted to share that are chock full of some resources that have been referenced during the discussion. Kelly Bratz, did you have a question that you wanted to ask or comment?
Looks like Kelly lowered her hand.
Okay. Do we need time to share those slides, or I wanted to give the panelists maybe 30 seconds each to give any closing remarks or thoughts about where we go from here? I'm hearing that community schools is a promising model. Again, it's nothing new, but maybe one that we might want to advocate and support as it relates to policy recommendations and changes, additional training for teachers and any adult that's working with young people. The importance of student voice and making sure that we're hearing from students as well as families. And then the really promising practice of peer work and success mentors, and just again, providing those supports to individuals who are going to be working with students. I just want to kind of open the floor to see if there's any other suggestions, promising strategies that you'd like to share with the audience today. Dr. Atisha?
I'll jump in real fast. So we're days away from the start of a new school year, right? And I think this is a really important time. You know, I'm biased on the health side, of course, but to share with our parents the importance of, you know, getting your preventative care services met. And where are some places that you can go if you don't have access? You know, get that well child done, get your immunizations, get the dental visit done. And then there may be services that your district offers to families. Make sure that they're aware of what those services and supports are. You know, identify resources in your local communities so that parents know where they can go to seek out those resources. And then take advantage of some of the resources that we've developed at Attendance Works, because they're really made to help you start off the school year with a healthy start, but then maintain that throughout the. You know, obviously we have lots of work to do here, but I'm excited for the discussion and for the possible opportunities.
Thank you. Great suggestions. Dr. Smith?
Yeah, not much to add. I would say, one, have a clear and purposeful mission that is translated well to your students and families so they can get on board with the purpose of your school. And then secondly, honest dialogue about what actually happens in your you know, upper primary grades and secondary grades. What is it that we actually face on the day-to-day that is interrupting the learning here? And how do we begin actually confronting those issues head on?
Thank you. Dr. Brooks DaCosta.
I'll just say something we learned during the pandemic was that the school is not a building, right? The school are the people that make up the community. And if we can take care of people, take care of human beings, take care of each other, and validate what everybody is going through, and try to create nurturing environments where people are taken care of, I think that's the foundation of all of these different strategies that we want to use.
I think that's a beautiful way to conclude our discussion. Please extend our appreciation to Dr. Don Brooks DaCosta, Dr. Elliot Atisha, and Dr. Derek Smith. Thank you so much for an enlightening and informative conversation. And at this time, I'll hand it back over to Ashley.
Thank you so much to everybody on the panel. Just really quick, I want to share with you all that we do have resources from the panelists. So some of the things that they mentioned throughout today's session, we have it here on the slide. We'll share these slides with you all so that you can have easy access to it. Also, we will have, this is a start of a series. So we have 3 more sessions lined up where we'll hear from parents and caregivers directly with lived experience, other school administrators, coaches, researchers, folks from all parts of the school will be joining us for the series on August 19th, September 9th, and September 16th at 1 p.m. Eastern, 10 a.m. Pacific time. Also, Dr. Douglas and her team, they will be working to develop a post-series brief that summarizes some of these innovative solutions, some of the resources, policy recommendations, And we will be sharing that with you all at the end of this series. So make sure you stay tuned for the upcoming sessions and for that post-series brief. Last but not least, I want to again point you all to the digital digest. We have resources from attendance work. We have resources about graded funding, supporting transition to college-age youth from high school to college with psychosis. Lots of different resources can be found in the digital digest, so we encourage you to take a look when you get a second. And we also encourage you to make sure you take a part of the poll. Help us to learn how we can continue to provide information that you need and want in your communities. We'd like to hear from you, so please participate in the poll. We will see you again on August the 19th at 1 p.m. Eastern. Thanks again to our panelists and to Dr. Douglas. We'll see you soon. Take care.